Hi, my name is Chris Kuhlman. I'm a certified hand therapist, and I'm excited to announce the launch of my new website and blog, helpforthehand.com, and my YouTube channel, J. Chris Kuhlman. So why did I decide to do a blog and do videos? So for 20 years, I've been treating people in brick and mortar outpatient clinics, which means I go to a clinic, they come see me, and I get to treat them. And that's great, and it's wonderful, and I've enjoyed it for 20 years. But it does look like this internet thing is going to stick around for a little bit, and this medium now allows me to certainly expand my radius and to help people in different time zones, in different countries, different hemispheres, and that's exciting for me because I do like to help people, and that's what I like to do. I've been doing many different things in the outpatient physical therapy and occupational therapy world for the last couple of years, from treating to the administrative side of it, and I do really enjoy getting back in and helping people on a day-to-day basis. So what should you expect from these blogs and these videos? Well, what you should expect is you expect education. You should expect insight, and it's a place and a resource for people to go to when they start to have problems or conditions, or they have a problem and condition. You walk into a doctor's office a lot of times, and the doctor's busy, and they're just going to start shooting out medical terms at you and information, and you kind of absorb it, and you're a little bit glass-eyed and punch-drunk when you leave. And that can be a problem because you start to explain it to other people or have to make decisions and you're not quite sure. Well, I'm a resource for you. You can say, wait a minute, I don't quite understand what this diagnosis is, and there'll be information about the diagnosis. Or what can I do next? Or what would you expect? Or what happens in this? And is it really going to be 6 to 9 months? All those things I can shed light on through my experience. Because again, I've been doing this for 20 years. I specialize in the upper extremity. I do have some knowledge on the other body parts, but I have a very small brain, and the upper extremity is really the only thing that I can fit in there. Now, I do have some knowledge on the other stuff and can certainly help you, but the upper extremity is certainly where I specialize. So also one of the things I like to do is when I coach and I educate people on stuff is I use a lot of analogies, I use a lot of metaphors, and I tell a lot of stories. And those things from feedback that I've gotten from patients and from people are what really separates me as a therapist from other people, because I'm not giving it to you in the medical jargon, but I'm bringing it home in take-home advice that you can certainly remember and you can certainly utilize to help yourself. I'm no magician. I'm not superior than any other therapists that are out there. I just think I have the ability to drive home points and to make it in lay people's terms so you can understand it, so you can see the benefit of doing things in certain ways. So one of the stories I always like to tell people, and they say, well, why do you like to do this so much, is that I had a patient about 10 years ago, and she had CMC arthritis, so her base of her thumb was very sore. And she said, I can't do the things I like to do. Well, I said, well, what do you like to do? She said, one of the things I do in my retirement now is I go to the hospital and I knit those newborn baby hats for them to keep their heads warm when they're first born. And she says, I love to do that, and I haven't been able to do that. Well, babies come all the time, and they never stop, and there's no peak season or any season. They just keep coming, and she really wanted to get back to doing that. So we worked with her, and we gave her some strategies and some advice on how you can't cure the arthritis, but there's certainly some things we could do, and we did, that helped her manage the condition and taught her about taking breaks and splints and things she could wear to rest her hands and to cool them off when they got sore. And she got back to doing what she loved to do. And the best part of the story is that my youngest son, who's 9, it was right about that time. And of course, when he was born, she showed up in the clinic with a hat she had knit for him in Bill's colors. So it was very nice. It was very meaningful. And that's really why I do what I do and why I love to do it, is because of that aspect of it and the people that are so appreciative. And it allows me to help people in doing what they love to do. So one thing, if you do have a little bit of problems with your hands, you certainly realize the significance of it and how really inconvenient it can be to have something go wrong with your hands. And if you haven't, I'm happy for you, but if you want to have a little fun is, try and use your phone with your non-dominant hand, or the hand you don't normally use it with. Try brushing your teeth later on today or tonight with your opposite hand. They won't feel as clean, it's going to take longer, and you may even jab your cheek a little bit as you do it. Or when you're eating a meal, try and eat it with the opposite hand. Those are the things people go through when they have pain in their hands or when they can't use their hands, either from fractures and stuff like that. So those are the people that I really want to touch and to give them a resource to go to communicate, to figure out how can we help them, how can we fix this? Is it a temporary fix, temporary thing that we can fix? Do you need a little bit more of insight in getting something resolved and things like that? So if you or someone you know has a problem or a condition in the hand and would like more information, please, I'd love to help you. You can email me at jchriscoolman.com. You can go to my website, helpforthehand.com. Check out the videos, subscribe to the YouTube channel, do all those good things to find the information. And I'll keep pumping out content and pumping out stuff. And if there's anything you particularly want to learn about, please let me know. I'm here to help you and to serve you. And I want to make sure I do that as well as I can. So happy 2018. Go Bills.